Hello, everyone. Good afternoon. Thank you for joining us this afternoon. My name is Nisa Shafi. I am with the Allergy and Asthma Network as their Director of Advocacy. On behalf of the network, I'd like to thank you for joining us today as we discuss what you can expect during your time on the Hill next week for our annual Allergy and Asthma Day on Capitol Hill. Additionally, I would like to extend the network's appreciation to the American College of Allergy, Asthma, and Immunology for their consistent support for this event. This year is especially significant as Allergy and Asthma Network is celebrating 40 years of advocacy in the allergy and asthma and related conditions space. For 40 years, advocates like you on the call today have helped spread the word on key legislation and policy that your representatives can help champion to help empower and equip individuals living with chronic conditions. As with some folks on this call, this will also be my first AADCH, so I'm beyond thrilled to meet you all in person next week on Wednesday, May 7th. A few housekeeping items before we begin. This Zoom call is scheduled for about an hour. We may finish earlier than that, but we ask you to reserve that time. In order to minimize disruptions, you will be kept on mute, so please use the chat function to type up any questions during the presentation. And I ask that you please reserve your questions till the very end. We have allotted time for question and answer, so this will make for a smoother meeting and ensures that we can get through all the important information to help you get prepped for next week. Finally, the presentation will be recorded and will be available on our website for viewing later. Your speakers today include myself, and I'm also joined today by Charmaine Anderson, the network's Advocacy Division Advisor. Charmaine has led this effort for the past 10 years, so we are very lucky to have her institutional knowledge on the call today and with us in person next week. Charmaine will provide some context into our key messaging for our legislative and regulatory priorities. And we are also joined by Kevin Schultz, President of Soapbox Consulting. Kevin is going to walk us through all the logistics that you will need to be aware of so you feel prepared for your meetings on the Hill next week. Along with Charmaine, Soapbox has also been engaged with the network for nearly a decade, coordinating Hill meetings for AADCH, and we greatly appreciate their efforts for their time helping us prepare today. At the Allergy and Asthma Network, our core mission has always been to work together to ensure that we can bring an end to the needless death and suffering due to asthma, allergies, and related conditions through our core priorities, which include outreach, education, advocacy, and research. Advocacy, of course, being the reason we're all here today. The month of May also happens to be Asthma Awareness Month, and the network has aligned its theme for AADCH with the Asthma Awareness Month theme of access. You'll find throughout our programming this year for the event that the central focus is increasing access to critical asthma and allergy treatments. There's a flurry of activity in the federal government at this time. And we are navigating different policies, various proposals, and just overall lots of different dynamics. So we are very happy to have you with us to amplify your voices in the allergy and asthma space in a very noisy Washington, D.C. at this time. Our priorities, as I mentioned, align with this year's, our core mission, of course, is to enhance access, which happens to align with this year's Asthma Awareness Month and AADCH theme. It also is at the network, the core priority to advocate for policies that ensure all patients have timely and affordable access to high quality healthcare services, including specialist care for allergies, asthma, and related conditions. This includes efforts to reduce barriers such as insurance coverage gaps, provider shortages, and long wait times for appointments. And you will see these priorities reflected in some of the legislation that we are promoting next week. Funding for education, research, and community engagement is another major priority for this year's AADCH, as we are pushing for increased funding at both federal and state levels to support education initiatives to raise awareness about allergies, asthma, and related conditions. When we are on the Hill on May 7th, the House of Representatives will also be reviewing the reconciliation bill, which contains a host of proposals for the national budget that aim to reduce or eliminate funding for some critical asthma and chronic disease programs. So your presence on the Hill that day is even more so appreciated. Additionally, we advocate for research funding to advance treatment options as well as community engagement to empower individuals and families with knowledge and resources. And through our priorities of outreach, education, advocacy, and research, we ensure that policy efforts target strategies to identify and reduce health risks that could lead to emergency situations with asthma and allergies. This includes advocating for preventive measures and medications, early detection protocols, and improved emergency response protocols in and out of healthcare settings. And finally, we work towards policies that address environmental factors contributing to allergies and asthma, such as air pollution, indoor allergens, and exposure to harmful substances. At the network, our goal is to advance policies that foster clean and healthy environments that minimize triggers. In the materials you'll receive the day of AADCH, you'll find a set of infographics, which I'll briefly overview in the next few slides. These infographics provide current statistics on asthma, severe and life-threatening allergies, seasonal or environmental allergies, and atopic dermatitis prevalence. It would be really helpful when you receive these to review these materials so that you can become familiar with what we're looking at in terms of asthma and allergy prevalence. So as you can see with asthma, 28.2 million Americans live with asthma currently. It is also the most common chronic condition among US children and the number one cause of missed school days, as 1 in 12 children have asthma. Around $81.9 billion are spent annually on asthma care, and other key statistics include deaths associated with asthma or because of asthma, as well as the overall medical costs associated with asthma care per person. With regard to severe or life-threatening allergies, 1 in 20 Americans have experienced anaphylaxis, and this is a condition that is a result of a life-threatening allergic reaction that must be treated immediately. A little over $1 billion a year are spent on direct medical costs related to life-threatening allergies, and 58.8% of anaphylaxis deaths are due to drug allergies. It's important to understand that anaphylaxis is very real and poses a severe life-threatening risk if not treated immediately. And individuals who do not suffer from severe allergies oftentimes find it hard to understand that anaphylaxis is an emergency that could be potentially fatal if not treated in a timely manner. So you'll see that a lot of our policies reflect expedited access to treatments and policies that reflect that. With regard to seasonal allergies, over 80 million Americans are diagnosed with seasonal or environmental allergies. This results in $18 billion of annual healthcare costs, and asthma and allergies combined are more common in African American, Hispanic, Latino, and Native American communities, particularly those living in low-income urban areas. Finally, with atopic dermatitis, 16.5 million adults live with this condition, and as a result, $5.3 billion a year are dedicated to healthcare costs for atopic dermatitis itself. And in terms of adults, it's 16.5 million adults live with atopic dermatitis, and 9.6 million children live with this condition. It also results in over $5 billion of healthcare costs every year. As I mentioned earlier, these materials will be available for your review, and you will also be sharing a lot of these images with the Hill offices that you'll be meeting with. So they will have access to this information as well to help supplement the advocacy that you're already doing. And with that, it's my pleasure to turn things over to Charmaine Anderson, who's going to discuss some of the key messaging and priorities you will advocate for during your time on the Hill. So Charmaine, you have the floor. Just please let me know when to advance slides.
Thank you, Nisa. And I want to say it's been a pleasure working with Nisa over the last few months. Certainly, having the responsibility of this particular event is a heavy lift, but she is doing it wonderfully. So I just wanted to give you your props here over this webinar. So you can go ahead and go ahead and advance the slide.
Thank you.
Thank you. So we are going to be advocating, obviously, for stronger federal policies and federal investments that improve the health outcomes of the millions of Americans who live and suffer with allergies, asthma, and other related conditions. We certainly want to make sure that we are asking for continued essential better care for Americans, access to treatment, and emergency preparedness. And to do that, we need Congress to help out here. And here's 3 key points that we want to address. One is making medications more affordable. The core message here is that no one should have to choose between breathing and affording groceries. Yet too many Americans with asthma and allergies are forced to really ration life-saving medications or find alternative means to address their issues. Secondly, making healthcare easier to get. Again, people with these conditions need reliable access to doctors, specialists, and treatments in order to stay healthy and avoid emergencies. And then lastly, improving medical research. Certainly, we want to have better treatment options that are developed. We need research that includes all types of patients living with asthma, allergies, and related conditions, and not just the few. And certainly we will, in addition to these key talking points, we will also have those available for you next week, along with some more details as it relates to these points. But we hope to also perhaps get these to you electronically in advance. You can go ahead and advance the slide. Aligned with our policy priorities and those key policy asks, there are some pending bills in the 119th Congress currently that we are seeking support for, and we hope to see them get enacted. First and foremost is the Smoke and Heat Ready Communities Act. This bill provides grants to local communities to prepare for and respond to wildfire smoke and heat events, improve indoor air quality in schools and homes, and protect populations that are more vulnerable to these conditions, like children, the elderly, and people with respiratory diseases. Our core message is, honestly, in addition to supporting this bill, is that wildfire smoke and extreme heat obviously are dangerous to the growing public health threats, especially for people who live with asthma and allergies. Secondly is the One School, One Nurse Act. And I know you all have, those who have kind of done this with us in the past have seen this bill pop up before. And it's certainly one that is very important to our community in that it helps to recruit, hire, and retain full-time registered nurses. And then ultimately it helps to improve student health and reduce ER visits and school absences. And the core message here is that every child deserves access to a school nurse, especially those who live with chronic health conditions. Next up is the Protecting Children with Food Allergies Act. This particular bill, this particular bill provides standardized science-based training for school cafeteria workers. It also helps ensure a quick recognition of when an allergic reaction is happening and certainly how to respond. And lastly, it helps to ultimately promote a safer school environment for all children. And the core message with this particular bill is that every child with a food allergy deserves to be safe at school. And certainly, to ensure that cafeteria workers receive training and know how to help and prevent and respond to an allergic reaction or allergic emergency when it's happening. You can advance the slide. The next bill, the Help Copays Act, which is another bill that's kind of been through the process for a couple of Congresses now. Actually, the last Congress, we literally got to the finish line, just to the finish line, but we kind of ran out of time before the 118th Congress adjourned. So we're hoping that we can make even greater strides and get this particular bill to the finish line, which this bill requires that all copay assistance counts toward your cost sharing limits, so your high deductible limits. And it is to really, the goal is to, as far as our core messaging is when patients use copay assistance, it should count. And it should count toward their deductible and their out-of-pocket maximums, because at the end of the day, many patients rely on these copay cards or manufactured assistance to afford medications like inhalers and like epinephrine. And the last bill that we wanted to kind of really advocate about is the Chronic Disease Flexible Coverage Act. And this bill allows for high deductible health plans to cover more chronic disease prevention and management services before the deductible is met. So for people with, or honestly, for people with asthma and allergies, oftentimes, if you can't afford your medications, this might mean skipping out on your medications or visits and things of that sort. So this particular bill will, again, provide patients with the opportunity to not skip those preventative care treatments and or therapies just because they haven't met their deductible. Next slide. And lastly, we want to make sure that members of Congress are considering just the funding aspects of asthma and allergy programs, as they are critically important for our community as it relates to the number of federal agencies that provide support for our community. One of the core messaging here is that we want federal asthma and allergy related programs that save lives and lower healthcare costs, which are certainly critically underfunded. We want Congress to maintain funding for these programs because, again, the funding is critical to reduce disparities in asthma. Funding is critical to help support community-based programs. It's important to advance research into allergy and asthma triggers. And one of the key programs that we have sent a campaign around as of late is the National Asthma Control Program. Certainly, as you all are aware, there's an effort underway to reduce the size of government to the detriment of some of the programs that are critically important to our community, one of which is the National Asthma Control Program. They have reduced the size of staff to the point where the program is ineffective and cannot be run. So we are seeking support to get this program funded in the fiscal year coming, fiscal year 26. So thereby we can have this program, because this program is critically important for not only just outreach and education, but certainly just to really help individuals manage their conditions. And I believe that is the end of kind of our key points that we want to make sure that we're advocating on while we're on Capitol Hill. Again, there are various pieces of bills that are pending in Congress, and certainly the federal funding opportunities that exist as it relates to these current programs that are listed here on your screen as Congress is underway to work on the FY26 budget.
Great, thank you so much, Charmaine. So going into our social media plan for the day, please make sure that you're following us on X, formerly known as Twitter, at Allergy Asthma HQ. It's important to know that social media channels are a fantastic way of amplifying messaging with members of Congress, especially a day as important as May 7th, because there's a lot of activity that's going to be going on the Hill that day. So it's of great importance that lawmakers are going to be reviewing, your posts, proposals, and it could help to have our messaging amplified during that time. To help make it easier for you, we will also provide a social media toolkit that is a print version of what we're already going to be scheduling out for you on our channels. So this will hopefully make it easier for you the day of, where you can just repost those tweets or various social media posts as you are going from meeting to meeting, so you don't have to type everything out. And we will also be we'll be sharing this the day of as well, the print version. Please also make sure to use the hashtag AADCH 2025 to make sure that we are visible during that time on social media. And a couple of tips for the meetings that you'll be attending. Please, of course, make sure to introduce yourself and include your name and your city or town. This is really important because all of your meetings have been assigned by your district, so your city, town, locality is of significance to the offices that you'll be meeting with. Please also provide an overview of the Allergy and Asthma Network's key issues and request support for pending bills, which Charmaine just covered for us. Your personal stories during these meetings have a huge impact, so please make sure that you're sharing stories that connect you to the legislation and the funding requests that we have to drive home the point that there are real people behind these conditions. And now they have the opportunity to put a face to the constituents' names. So please also make sure to stay focused and keep the conversation simple and polite. This is a coordinated effort, so you're going to be representing your fellow advocates and vice versa. So a thing to keep in mind is if you happen to hear a member or staff opposed to a certain issue, please keep in mind to be open to hearing them out and offer to follow up with some information that could help, uh, their position later on. But the emphasis should be on polite and productive conversations. And you'll receive more information the day of to help you with navigating those spaces. For the big event, the evening before the Hill Day is our welcome reception at the Morrow Hotel, and this is where the breakfast briefing will also be held. So we'll convene bright and early Wednesday morning on the 7th at 7 a.m. for registration and breakfast. We will go over logistics for the day, and around 9 a.m. we will adjourn to go to our respective Hill meetings. We'll gather together again for our lunch briefing, and this will be a brown bag lunch event, so you can drop in and out as needed for your meetings. But during the lunch briefing, we will be joined by Congressional Hill staff, advocates, and other stakeholders in this space. So it's a great opportunity to hear from our speakers on the critical issues that we'll be advocating for. And as for the speakers themselves, we will be joined by Representative David Valadeo, who is the co-chair of the Congressional Asthma and Allergy Caucus. We will have representatives from the American College of Allergy, Asthma, and Immunology, from their advocacy division, as well as their executive director of advocacy and government affairs. So there's going to be plenty of representation there from the college as well, who is a great supporter of this event. And also we will be joined by Casey McPherson, who will represent the patient access perspective during the lunch briefing. For the meeting itself, you will receive materials like I mentioned, so that this will be during the breakfast briefing. Will you receive all the materials for both yourself as an advocate and for the offices that you're going to be visiting. So those are the leave behind documents that you're going to be sharing with those Hill offices. Please keep in mind to wear business or business casual attire. You're going to be walking a lot. Washington, D.C. blocks are not normal city blocks. They're the equivalent of probably 2 or 3. So please wear comfortable shoes. And keep in mind that these are federal buildings, so you're going to be going through metal detectors. So please be mindful of what you have on your person when you enter the building, and try to keep your jewelry and accessories to a minimum. This is from personal experience. It's really tedious to take everything off through the multiple buildings that you'll be entering. And hopefully with this time next year, these pictures will be updated with your faces. So we're really excited to have you join us and help amplify the critical messaging that we've shared with you during this call. And thank you again for your support and attendance. And to pass the baton again to Kevin. Kevin will be going over the logistics for the big day.
All right, thank you, Nisa. I'm Kevin Schultz. I'm with Soapbox, and we had the honor and the pleasure to schedule your meetings. And I'm going to go through the logistics for your day on the Hill. And I'm going to go over some things that you may have heard just now in terms of bill co-sponsors, how you will know if your member of Congress co-sponsored one of our bills so that you can say thank you. I will also let you know, you saw the photos there just a moment ago, how to give us the photos through the mobile tool that I'm about to describe. And then I'll also let you know details like, how you'll find out about your preliminary schedule, how you'll get a printed schedule, all of those good details. Let's go to the next slide, because I want to start with you all, where you all come from. So the last time I checked, there were 81 of you coming from about 22 different states. And we can go to the next slide so that we can show everybody these numbers. And you'll be conducting about 100 meetings in the span of just a few hours. 34 of those meetings will be with Republicans, and 67 of those will be with Democrats. And I give you that last information as background only. We don't bring up political entities. We don't talk about campaign contributions. When we're on the Hill, when we're on the legislative sphere, we stick with our message. All right, let's go to the next slide, please. Before you get to town, you will get a preliminary schedule because Soapbox will email you a mobile tool code. So we call it a mobile tool because it's not an app. It's simply a website. It works on your desktop, it works on your laptop, and once you're in town, it will work on your smartphone. So it works on all of those at all times. The first time you go in, it will ask for a cell number. The reason we ask for your cell number is so that we can text you with changes on the day of the event. Meeting times will change. Those of you who have done that before know that there are often changes when you're on the Hill. The tool keeps your meetings in real time. So when the changes happen, you'll know. Once you're in town, we'll remind you about your mobile tool code because it will be right at the top of your printed schedule that you will receive at the hotel. Because there's more that you can do with the mobile tool once you're in town, you can keep using it once you're in DC. When you first look at your schedule, which you will get tomorrow, your preliminary schedule, you will see a few TBAs. Those TBAs are not declines. Those are offices that schedule close to the meeting date. We're oh so patient with those offices so that we can give them the highest chance of telling us that the member of Congress is going to join that meeting. So just remember, when you get your preliminary schedules in an email tomorrow afternoon, TBAs are not declines. We're still working on those. And you don't have to contact any offices to make any changes. When you get that email tomorrow, you can reply to us and let us know if anything looks off. Let us know if you need to cancel. Anything at all like that, you can reply to our email and let us know. All right, so I want to point out a few buttons on this mobile tool. The most important one to you is that red button at the very bottom. If you have any questions on the day of the event, you need to make a change, maybe someone needs to drop out of a meeting, you will press that red button and you will get our help desk. We have more than 10 people here waiting to help you and give you live assistance. Once you are in town, under every single meeting on your schedule, you will find an icon of a megaphone or a bullhorn. That is the most important part of the mobile tool for Charmaine and for Nisa. That allows you to give them feedback after each meeting. It also allows you to attach a photo to the feedback form. A still photo is perfectly fine in these meetings. You ask for permission, they grant it, and you can upload that photo to the feedback form. In no cases have we asked for approval for a video or a recorded audio, or excuse me, an audio recording. The reason I bring that up is because that's a serious transgression on the Hill to record any meeting. You'll notice they shut down right away, but still photos are perfectly fine. All right, let's go to the next slide, please. When you get to town, you will receive a printed schedule. It will have all the latest details about your meetings. You'll notice that your name and your district are on the upper right corner. Our help desk number is right below there. Your mobile tool website and your schedule code is also at the top. We'll note who is on your team for the meetings. No one is alone in these meetings, so you might see people from another state, and that's because we sometimes pair states together, so no one's alone. So if you happen to see somebody from another state, that's why. We will note on your schedule if your member of Congress is on one of our key committees. And then Charmaine went over all of those bills that we are interested in. You all have told us over the years that you want to know before you even go into a meeting at a glance if your member of Congress co-sponsored one of our bills, so that you know you can say thank you when you're having that meeting. So just know we will track those co-sponsors of the bills right on your schedule, so you'll know that before you even go in. Now let's go to the next slide, please. On the back of each printed schedule is a map of Capitol Hill. The map shows each entrance to each building. It shows the accessible entrances. It shows places to eat. It shows estimated walking times between the buildings. The U.S. Capitol building is in the center of the hill, with the Senate buildings just 1 block north, the House office buildings just 1 block south. Your 2 Senate meetings will be in one of those 2 or 3 Senate buildings on the north side of the hill. Once you are near one Senate meeting, you are very close to your next Senate meeting. I tell you that because sometimes folks worry about whether there's enough time between meetings. In each case, we've asked for your meetings to be 1 hour apart. So we have thought of that. We suggested that to each office. If you see 30 minutes between meetings, you'll notice it's on the same side of the Capitol. So you'd be going from a Senate meeting to a Senate meeting or a House meeting to a House meeting. And it's also because the office told us they could not give us the hour slot. You'll have plenty of time to get to that next meeting. And if you have an issue or you're running late, you'll call our help desk. We'll call ahead, let them know you're running late. They'll hold your spot for you. All right, next slide, please. Once you are here in DC, we asked you to keep a few things in mind. For the first one, I know we've already gone over that. The second one I mentioned as well. I just want to remind everybody we don't record a meeting. And finally, we've given each office an accurate roster. I bring that up because we never want to skip a meeting or it will upset the office. So if you're tired or you're not feeling well once you're up on the hill, no worries. You're just going to call us. We'll call ahead to the office, let them know that the group is coming in place of the constituent. Never a problem to let them know ahead of time if someone's not coming or if we need to cancel. It's only an issue when there's a no-show that they remember us for the wrong reason. So we just want to make sure you know that each office gets an accurate roster so you will follow your schedule as you see it on your printed schedule and your mobile tool. All right, next slide, please. For this last slide, I'm going to leave most of the details for when you're here in town, but I want to mention that when you come into the hotel conference room, you will notice state table tents on each table. It's important that you sit at the table with your state because you will get your printed schedule much more quickly if you sit there. You will also be able to meet the other people from your state. So you're with the people that you're going to your meetings with. You can practice a little bit before you go to the Hill. And most importantly to us, it allows you to bring us back any unclaimed schedule so that we can let an office know if someone is not here. All right, next slide. And with that, I want to say it's going to be fun. You're absolutely going to enjoy this. Once you get through your first meeting, the jitters start to go away and you really have a great time and you're going to want to come back again and again. And so please let us know if there's anything that we can do to help when you receive that preliminary schedule tomorrow. And with that, I thank you and I'll hand it back to Nisa.
Thank you so much, Kevin. Really great operation you're running. I'm excited to be a part of it. So if folks could enter any questions in the chat, that would be really helpful for Charmaine and I to address anything that you have concerns about or any questions in general for the big day. I don't see any, oh, maybe one. So I received a question: when we're presenting the bills, do we each take on a specific bill? So there's going to be time built in the morning where you'll convene with your group and you can strategize how best to do this. But I would recommend, since there's a group, you're going to be speaking on the same bills in each meeting, to come up with a plan amongst your group to decide who takes on which talking point. That's how I would do it, but I welcome Charmaine to share any tips on what the best path forward.
That's absolutely right. We normally kind of let the groups determine who might be the lead as far as introducing the group into the at the meeting, and amongst yourself determine, you know, who would like to take on which speaking role. Everyone, oftentimes we find that the group is a mix of folks who have passion and or experience with certain issue areas, and they might have a little better explanation or a more personal story to share. So it'll be amongst the group to determine how best to provide the message with the members. But just remembering that you probably only got to have a good 15 minutes or so to kind of present your case and make those requests of the members and staff.
Thank you, Charmaine. And we also have oh, were you saying something? Okay. We also received another question. Will we receive our packets the evening of the 6th? You're going to be receiving the morning of the 7th. And then we'll go over the materials during the breakfast briefing. And that's when you'll meet with your group and discuss what Charmaine was discussing just now. So you'll come up with a plan of assigning, and this will be a flow that you come across throughout the day. But we do ask that you're respectful to the group and you allow everyone to have time to talk within the group. It's when you're meeting with the Hill offices as well. And the question also is that, will we review all of this again in Washington? Yes, the morning of the event, we'll review all the material, go over some of the talking points so that we can be aligned on all of those messaging. Okay. I think, Kevin, you answered Maureen's question. Thank you there. I will have to check to see if we can share the list of attendees, but we are more than happy to share which states will be represented during the Hill meetings. I don't know if there's a privacy issue there, but Charmaine, do we usually share attendees with the publicly?
We have not in the past. We would have to kind of check internally on that. I just, for the sake of, you know, individual privacy, if that's the case. So we can certainly get back to the individual who asked the question, to Maureen who asked the question. I think can't remember who answered that question.
It was Nina, but yes.
Oh, Nina. Okay, Nina. Okay.
And let's see. Can we mention pending legislation at the state level to the representative and senator?
Unfortunately, we discourage that. Members of Congress are not necessarily interested in what's happening stateside as far as legislation because they cannot participate in that. So we like to encourage our advocates to stay on message so we don't confuse the members of Congress and staff of what our asks are.
And the other question is, will we receive a summary of the bills to discuss? We have linked all of the bills to the materials that you'll receive. So we will not be providing summaries of the bills, but you will have the bill number and we'll be able to reference it when you attend your meetings.
And one key thing by way of that question, the bills that we are asking folks to advocate for while they're here in person have all been part of our federal campaigns that have been sent out electronically over the last few months. So if you go to our website on advocacy, you will get a snapshot of a summary under the Take Action page of each bill. The only bills that are not listed on those campaigns are the federal funding bills, because there are so many and because the process is just underway. But you will see the key legislative bills that I highlighted on our website under Take Action Federal.
I think we have a few more questions. Oh, nope, we've answered these. So are there any other questions from the group? This was really helpful. Thank you, Charmaine.
And I'll just real quickly, I just want to restate the goal is to hopefully at least push out the talking points to you all that are registered before you arrive into Washington, so you have them. I know it's a little bit to digest for those who this might be a new experience. So we certainly want you to feel as prepared as possible. So at least from the vantage point of the talking points, you'll be able to have those not only in your folders when you arrive on Wednesday of next week, but we'll hope to get those out to you, if not tomorrow, on Monday, electronically.
Great, thank you. We also received another question asking if it is important to attend a meet and greet if you're not able to do so. And it's okay if you cannot make it on Tuesday evening, that's totally fine. The most important meetings for the advocates attending in person are the breakfast meeting, because that's when you'll receive all the materials you need and get your itinerary for the day. And then, of course, the plan for your Hill meetings. And of course, the lunch briefing, if you're able to make it based on your schedules. So the dress code for the meet and greet is, I believe, business casual. It is a reception. So.
And Lisa, let me interject real quickly. We know individuals are coming literally, whether it's planes, trains, or automobiles, so it's not necessarily business casual. Business casual. I mean, you certainly can, if you're traveling, we totally understand. It is a very, casual environment. So again, just to kind of clarify, because we understand many folks are traveling coming into Washington.
Yes, very important. Thank you. Great, thank you, everyone. If there are no other questions, we're happy to give back 15 minutes of your time, and we're incredibly excited to see you next week and do some great work with you all. We're going to go ahead and stop sharing and, oh, one more question. Any insights on pulmonologists and advisors who are attending? Priya, if you would like, you can go ahead and send me a note. I will go ahead and follow up on that information. As Charmaine mentioned, we're probably not going to be able to disclose who's attending, but I can go ahead and share what that looks like in terms of figures and representation. And if you need to get in touch before the event, please reach out to me. I'll be happy to find any answers that you need. Thank you, everyone.
Take care, everyone. See you next week.